If you suspect your birth control is contributing to or even causing your migraines, you might be right. So in this video, I'm going to share a few red flags that your birth control is the culprit behind your migraines, and the number one indicator that should absolutely prompt you to have a conversation with your doctor. So stay tuned. So my name is Dr. Tanya Paynter. I am a naturopathic physician who specializes in helping women with chronic migraines figure out what's going on for them so that they can actually get relief. I've had chronic headaches myself for 15 years, up until the time where I figured out my own unique combination of biochemical triggers that were contributing. Now I've been migraine free for about 6 years and counting. So I want the same for you as well. So I get asked this question a lot about, could my birth control be contributing to my migraines? And the conventional answer is probably not. It usually helps. I'm going to argue the opposite in a lot of cases. So absolutely, birth control can be a miracle for some women, but for others, it will actually make their hormone imbalances worse to the point where they actually are having ongoing migraines as a direct result of their birth control, whether it's an IUD, a patch, a pill, an injection, whatever form it is for you, could very well be contributing. So we want to address what some of these red flags are in a minute. So it's really important to identify if those synthetic hormones could be contributing to your pain levels. There can also be a lot of other side effects that come along with it that people are just not aware of. Things like mood swings, which maybe you know, but problems sleeping, changes in digestion. If you start getting sick all the time, changes in immune function can be related to hormones. Nausea can be related to hormones. And one study showed that women on birth control that had migraines with aura were at increased risk for stroke. So this is not something to be taken lightly. And if your doctor has just dismissed your concerns, listen a little further and see if you do think indeed that this is a problem for you. So there's three main things that we end up seeing is contributing or pointing us to whether or not migraines are related to the birth control. So the first situation that we often see is that migraines are made better after starting the birth control. That's likely not the case for you, or you probably wouldn't be watching this video right now. So we're going to just move on. Number two is there is very obviously a clear connection between you starting your birth control and then your migraines getting worse. And so a lot of times, as I mentioned earlier, you'll take that information to your doctor and they'll say, no, that's not related. Well, it is related, because anytime we have changes in hormones, it can be related to progesterone, it can be related to the estrogen. It could be that that is not a good fit for your body. It could be that synthetic hormones are not a good fit for your body, period. So that is something that definitely needs to be explored a little bit. If you know like there is a direct correlation there, then most women just choose to go off of it themselves without listening to their doctors saying that it has nothing to do with anything. But the insidious one, it's kind of the red flag one, is the third option that I want to talk to you about. So this is where you start on the birth control and you're really hopeful that it's going to help, and it doesn't really do anything. It doesn't make it better, it doesn't make it worse. Maybe it makes your periods a little bit lighter, a little bit less cramping, and you're like, okay, well, that's nice. But dang it, it didn't help with my migraines. So this is where it can be a really tricky thing to figure out, because what can end up happening is that it takes some time for the synthetic hormones to influence these women's bodies. So if this is you, pay close attention, because this could be part of what's going on for you. So I want you to ask yourself 3 questions. Number 1, when did you start taking the birth control? And if you can remember as exactly as possible, great, write that down. Number 2, when did your migraines start getting worse? If the answer to that second question is within 6 months of starting the birth control, it very likely is related. It's just in a sneakier way that it just kind of maybe a slower onset that you didn't quite realize. So see if there's a correlation there. And number 3 is, when did any of your other health concerns start getting worse? And again, if you noticed that maybe you started getting sick more often, or you had more joint pain, or you started feeling more tired, or any of those kinds of things, your nausea started to have GI issues, and any of those symptoms started becoming more pronounced within 6 months and perhaps continued to just get worse and worse and worse, then it could very well be that the birth control is contributing to your symptoms. So that is the number 1 red flag, is that there's a correlation between your symptoms worsening shortly after, and shortly being that 6-month time period of being on birth control. When I do this evaluation with my patients that come to me on birth control, and we start kind of digging a little bit and asking some of these questions, it is surprising how many women start making that connection, that, oh my gosh, you're right, I've been on birth control for 20 years and my migraines started really getting bad shortly after I started it. We stopped the birth control and migraines start to improve. So let me know in the comments if you found this helpful, and if so, what was the number 1 thing that you found most helpful about this? If you want to hear more videos like these, then subscribe to my channel. And, I'll have a lot more content around things that you can look a little bit further into to figure out what is going on with your migraines and help you get control of them. Until next time.